Okay, so this is 2023, and we are kicking it off with our healthcare channel. And we're going to do something a little bit different. We're not actually talking to a doctor today, but we are talking to someone who has to deal with healthcare and healthcare issues, so to speak. So our concept is to take it from the perspective of someone who is in human resources, in the business world, business community, and healthcare, and how those two things link up, and why healthcare is important when it comes to a business. So first of all, I'm going to ask you to introduce yourself, name and title, please.
Hi, my name is Lauren Brady, and I'm Senior Human Resources Manager for Texas for Klein Tools.
Excellent. Okay. And so how long have you been doing that?
I've only been with Klein almost 4 months. Sorry, had to do the math. It's been about 4 months. It feels like a lot longer, but in the best way possible. I love the company and I love my job. I love the people I work with.
Good.
Yeah.
So I want to talk about how healthcare kind of comes across your desk. So, and when we talk about it, just from a bigger picture perspective of why it's important, I guess.
Yeah, so my answer to this will be twofold. So one of the reasons why it's so important is the external candidate marketplace. So we've all heard about the talent marketplace and how hard it is to attract candidates, but also retain them. And in this post-COVID world, having solid healthcare available for our employees is seen as a sign of respect. And it's a major deciding factor for many candidates when they are looking for their next professional home. So that's part of it. We have to make sure that we have good healthcare to make sure that we're competitive at attracting and retaining our team. The other part is making sure that our team is as healthy as possible so that we can achieve our business objectives, right? So I wasn't with Klein during COVID, but I have heard stories and can imagine, we've got all these machines right out there, and we've got an entire country full of tradesmen that are depending on our tools to help them be able to do their jobs every day. And ironically, during the COVID shutdown part of the pandemic, the electrical grids and the stability of our hospital systems really depended on our tools and all of the tradesmen who use them. But then obviously we have actual people who are susceptible to COVID operating our machines and making our products every day. So having solid healthcare in place for them is really important, just from a mitigating business risk and business continuity perspective as well.
So talk about it from the aspect of attracting talent. What is it that you're seeing that people are actually looking for when it comes to those types of benefits?
So they're looking for lower deductibles. They're looking obviously for low premiums. So we do the best that we can there, but they're also looking for a variety of options. So gone are the days of just having a PPO plan and everyone was happy with that. You got to have different options because people are in different places in their lives, family status, all of that stuff changes. In our demographic or our population of our employees, it's a very broad spectrum. So we have to make sure that we have healthcare options, as many healthcare options as possible to meet all of our employees where they are for their specific place in life.
So what do you think the biggest challenge is when it comes to that, to find, because you say options, that could be like all kinds of things.
Yeah, so we have a traditional plan, we have an HSA plan, we have a high deductible plan. So there are some people who might be more comfortable with shouldering the burden of a high deductible plan because they get lower premiums and they feel like they don't get sick very often. Or someone like me who has a whole bunch of children, I opt for the more traditional plan because bones break all the time and everyone's good sick at the same time. So for me, it's worth it to pay a little bit higher premiums because I've got so many people, so many kiddos in my house that are relying on being able to go to the doctor a lot. So, but the biggest challenge from a business perspective really is how do we keep the premiums low?
Yeah.
Yeah.
So what are the strategies that you guys have done that work, and maybe some that you tried and they didn't work?
One of the strategies that's worked really well for us the last few years is having incentive programs that help incentivize a healthy lifestyle. And when our employees participate in those programs, they actually get dollars off of their monthly premiums. So we have a tobacco cessation program. We have an age preventative program, which encourages them to get a flu shot, an eye exam, dental cleanings, those kinds of things, and then an annual one as well. So it really incentivizes those people that are like, I never go to the doctor, maybe they haven't been in 5 to 7 years. And when you see your premiums start to go up, every single month, that's a quick way to incentivize people to get to the doctor, get your annual screening, go to the dentist, get your flu shot, all that kind of stuff. We're also really grateful and blessed that we have an occupational health and safety nurse here on site. And so we utilize her a lot too to help with keeping our workforce healthy.
So now, do they use her like a I don't know, like a kind of a little urgent care, or?
It's more for reducing the risk of strains, sprains, the repetitive in a repetitive manufacturing environment. But she does do a flu shot clinic for us, and is always available to give us any health advice that we might need.
So have there been things that you've tried that weren't as successful?
Since I've only been here 4 months, I don't really know. But I do know that the key component of keeping our premiums low for our team is our incentive programs.
Okay, so that's worked the best, and do you think that the cost of it is the largest thing, or, well, I would say probably the cost of the insurance, but also if they're out sick, that also creates not only an increase, but because they're probably drawing from it, but also now you've got downtown. So it's probably the balance of everything, right?
Right. Yeah. I mean, having a healthy workforce, there's so many intangible costs when you've got so many people out, either with injuries or illness, or even sick kids at home,
Yeah.
So there really is, I'm sure some really smart person somewhere has calculated the intangible costs to businesses, but
Yeah.
being here in a frontline kind of organization, manufacturing, we measure very clearly our production, and you can there's a clear difference and a clear impact to the business when our team isn't healthy.
Are there other things that you guys do from a proactive standpoint to keep people? And let me ask you this, I guess. I know one of the biggest concerns I hear a lot has to do with mental health. Are there things that you guys are doing from a proactive standpoint on that?
Yeah, we have a program that we use that encourages mental health from an app. So they've got resources literally at their fingertips. We also have mental health coverage through all of our insurance plans, and we have EAP also as well available. So the employee assistance program that they can reach out to get free mental health visits, either in person or through telemedicine throughout the year as well. And that's for all of our employees, not just those who opt into our healthcare plans.
Huh. Now, this app, is this through a third party? I mean, what?
There's tons of them. Yeah, tons of them. So they're third party apps where you can reach out to mental health professional right at your fingertips. Yeah.
Wow.
So I can't remember the name of the one that we use, but there's tons of them. If you just look up mental health employee benefits.
Really? Okay. Yeah. So you have to get me the name of it, and I'll insert it in this video, because that probably is the number one concern I think most employers have right now that I've heard is mental health more than anything.
Yeah. And again, mental health is really intangible too, because even if people are here, if they're not at their best,
Yeah.
What is the impact that has on the people around them, on the way that they're able to contribute to their team, the way that they're able to perform. So I know a lot of times we think of mental health as needing time away from work, but it's really just as important to make sure that when they're at work, that they're bringing their very best selves with them to work every day.
Yeah. So is there anything in the future on the horizon that you guys are focused on when it comes to health overall?
Yeah, we've got a lot that we want to do. So yeah, we've got a plan for the next few years. So we always plan to decrease our premiums, or at least hold them stagnant. We are also looking at some Gympass options as well. That's one of probably the thing we hear the most from our employees, is that they want to be able to go to the gym and have a gym membership. And we know that
Really?
yes. Yeah, it shocked us too, but it's the number one ask. So we weren't able to include it in our benefits package for 2023, but we're pretty confident we'll be able to do it in 2024. And again, there are vendors who facilitate all of this for you too, where we pay a PEPM for each employee, and then based on the level we opt into with this vendor, they give discounts. So for like a gym that might be $25 a month, that would be free for the employee, so they would never have any cost. Where something more premium like Lifetime might cost them $30 a month, as opposed to their normal like $70 or $80.
Oh, so they have, I like that. So again, options.
There's options.
Yes.
Yes.
That's like the key word.
It really is.
For the future is options.
It really is. And with an employee population as diverse as ours, from an age and generational, family, no family, we have a very broad spectrum here. Yeah. So options are key to making sure.
But I love that.
Possible.
Yeah, I love that concept that you can have, especially, and again, you're gonna have to get me the vendors, but somebody that manages that and then says, okay, let me go work these deals. And then you've got discounts. Where do you want to go? Do you want to go to Lifetime, or do you want to go to 24? Where do you want to go? And they don't feel, because a lot of times those things are done with one place and people are like, well, I don't want to go there. Or I don't want to do that. I want to do this. So that's interesting.
And I think Gympass, Gympass is the name of the gym vendor. I do know that one. And it's definitely, the PEPM is based on your company size, right? So I won't give you our quote because it's based on our company size, but especially for a small business, it seems really reasonable monthly. And it's a great benefit to be able to offer your team it's like two birds with one stone, right? Because that's physical and mental health. Yeah. That you get there, and from an attraction and retention standpoint.
That's what I was just thinking. Yeah, it's both, because now you can use that as your, that's great.
It checks a lot of boxes and is much cheaper or much more reasonable cost for small businesses when a full-scale healthcare program may not be.
Yeah. All right. So options. The number one ask is a Gympass.
For us, it is.
Yeah,
it is.
That's interesting though. I mean, but how many employees do you have?
1,500 total.
Okay. Well, that's a good sampling of, because you've got people doing all different types of jobs there. So 1,500, and that's a good benchmark.
Yeah, and that includes our more labor population that's actually operating machines, hands-on skilled labor workers, and our corporate professional roles too.
What else is a number one for employees?
In terms of what they're looking for?
Yeah.
Flexibility. So that
options.
Yeah, options, but flexibility with time. And I think that also plays into mental health as well. But again, post-COVID, there's a lot we learned with COVID, right? And one of them is that sometimes you can do your job from home. Sometimes you can't when you're operating a machine out there, right? Yeah. So we've had to think about, okay, how do we express flexibility and understanding, compassion, empathy, all of those things to our plant level employees, because clearly they cannot operate a CNC machine
From
from
home.
their home office. Yeah, that's not going to work. So we've had to think differently about like our attendance policies, LOA requests too. So I've worked for several companies that didn't offer any type of personal LOA. So if your situation did not fall into FMLA criteria, your job wouldn't be protected. So that's actually something that I think we do really well here. That's been different from those companies that I've worked for in the past. We do offer personal LOAs as long as the business can withstand the prolonged absence. We want to make sure that our team feels supported, and
Right.
that's our way of showing some flexibility.
Well, and I think that that's good because, there is a definite connection between the mind and the body.
Yes.
And if you can keep people happy and mentally
Mhm.
a-okay, well, that has the domino effect of keeping them healthy in their body.
Yeah.
So
And they're more engaged when they're at work. So
yeah,
they're here to do the best work that they can, and they're not distracted by, the stresses of life, life on the outside.
yeah. Excellent. Okay. Thank you very much. I
Yeah,
appreciate
you're
it.
welcome.